name is Paul Beedon. I'm a consultant clinical psychologist and lead for psychology and bereavement services at Romans Hospice. Over recent years, an increasingly important role of my service has been to provide clinical supervision to staff on the inpatient unit, the hospice at home team, the Remind service and the Living Well Centre. My team and the senior management team across the hospice are invested in ensuring we provide you with the opportunity to attend regular high-quality supervision sessions, and that you in turn value the process, understand its relevance to your work and make time to participate. This video is designed to outline the purpose and value of the supervision process so that you can make informed decisions about attending the sessions we put on. The fact is that we've not yet achieved the consistent levels of participation at supervision sessions that we as a hospice aspire to. My team will tell you that too often we arrive to empty seats when we come to lead the sessions. Now, over the years, I've run sessions both inside and outside the hospice. In the most successful of these experiences, I found that you'll get a core group of skilled professionals who'll turn up session after session, engaging in the discussions with interest, and will leave having developed new and valuable insights. At times, supervision participants have shared with me the reasons that their colleagues choose not to attend supervision sessions. This has helped me what many of the barriers to attending can be. Over the next few slides, I'm going to share with you the most common ones that I've heard. See if any of these resonate with you. Then I'm going to give you more details about what supervision is and how it can work. At the end, I'd invite you to revisit any of the barriers that resonated with you and see if you still feel the same way. These then are the barriers to attending that I've most frequently encountered over the years. All of them arise from people's attitudes to the concept of supervision. The first is the idea that if we're proper professionals, we've a job to do that's all about technical skill, and it's therefore weak or woolly thinking to need to consider our own emotional experiences within the context of our work, or to explore the fact that patients and their families will often demonstrate complex feelings and behaviours that we need to take time to consider in order to respond in the most effective way. Building on this idea is the further position that it's just overthinking and unnecessary, which is sometimes expressed as it's fluffy and soft, it's navel-gazing, it's indulgent. Next, there's a group of people who do occasionally attend supervision, but most of the time think, I don't have any issues right now, maybe next time. I'll share some thoughts later about the value of being able to just bring day-to-day puzzles so that people don't feel they have to have a major issue in order to come along. It's just that ordinary exploration of the slightly complex that we encounter every day that often supervision can help us address and learn and share our learning with others. But it's also key to remember that we're going along to support colleagues who may bring their own puzzles and who may need our support. So often that's the reason to come this time. There can be the thought, I don't want to be told I've done something wrong. And this is often a misconception of supervision, that in some way it is about telling people what they should have done, how they should feel. Sometimes it comes down to people thinking, what on earth does a psychologist know about my job? I don't need advice from them. Again, there's this misconception that it will be the psychologist telling a nurse or a social worker or an allied health professional what they should do, when indeed it's more about the facilitation, the exploration, the supporting of each other. For some, the idea of supervision can seem scary for other reasons, such as they feel like they should always have all the answers, or that somehow by sharing their emotional experience to things, or the fact that something has felt difficult to them, they'll be seen as not coping. Then there's the school of thought that you should always be going full steam ahead and do your best to ignore that which is challenging. The idea being that if you don't mention it and carry on, you'll be okay. This might be true until it's not true. That is to say that eventually, by not attending to difficulties, they add up and do harm. And for many, there's the feeling that they simply have more pressing concerns that must be prioritised. And it's inarguable that working on a busy ward, working into a busy community team, throws a lot at you, puts a lot of demands on you. But thinking about how we prioritise using the space in order to process that, look after ourselves, and think about how we look after our patients and their families, I argue remains absolutely pivotal. I believe that many of these misgivings about supervision stem from one key factor, and that's that most people think they know exactly what supervision is for, yet I believe few really do. It's a word we bandy about all the time without taking the time to unpack its real meaning. So that's what I'd like to do next. A conversation with a valued colleague helped me understand what is likely one of the most common misconceptions about supervision when they told me, I always thought supervision was just a form of counselling, and if you don't need counselling, then you don't need supervision. But it's important to dispel that myth because supervision isn't counselling. They are separate and distinct processes. A key function of supervision is supportive, is the group supporting each other, is the facilitator approaching the process in a supportive way. So there is a restorative function of supervision, but it is not the only element. There are multiple elements to supervision, each carrying equal weight in their importance to the overall process. So having dispelled that myth, having looked at what some of the barriers to supervision are, let's get into looking at what supervision is. The Royal College of Nursing defines supervision as a term used to describe a formal process of professional support and learning which enables practitioners to develop knowledge and competence, assume responsibility for their own practice, and enhance consumer protection and the safety of care in complex clinical situations. They go on to say that it is central to the process of learning and to the expansion of the scope of practice and should be seen as a means of encouraging self-assessment and analytic and reflective skills. The Nursing and Midwifery Council identified the possible benefits of receiving effective clinical supervision as improved capacity to identify solutions to problems, increased understanding of professional issues, improved standards of patient care, opportunities to further develop skills and knowledge, and enhanced understanding of one's own practice. And the Care Quality Commission advises clinical supervision should be valued within the context of the culture of the organisation, which is crucial in setting the tone, values and behaviours expected of individuals. It should sit alongside good practices in recruitment, induction and training to ensure that staff have the right skills, attitudes and support to provide high quality services. They go on to say that importantly, clinical supervision has been linked to good clinical governance by helping to support quality of improvement, managing risks, and by increasing accountability. So that's the RCN, the NMC and the CQC impressing on us the valuable role of the supervision process. For the social workers and AHPs out there, there are similar policies and statements from the HCPC and Ofsted. But those definitions cover a broad range of functions of supervision, so let's break it down to three key elements. The first element is that it promotes quality. By openly reflecting on practice, we promote high standards of care in relation to safety, ethics, and quality. It promotes development. Discussion with other clinicians increases professional knowledge and skills and uses reflection to actively apply theory to practice. And it promotes restoration. So the supportive elements of supervision focus on self-care, self-awareness, and self-development. So that is accountability, learning, and support as the three cornerstones of the supervision process. And these can be seen to lead into 5 key outcomes. That it supports the professional for their practice and reflection, it supports continuing professional development, it improves well-being, it improves work environment and culture by that self-awareness amongst teams and the way they interact being developed in the supervision process. And all of this contributes to better patient outcomes. Now let's consider how this actually plays out in the supervision sessions we run. I'm going to share with you the description I've fine-tuned over time that sets out our philosophy and approach to running group supervision sessions for healthcare professionals. The aims of the group supervision sessions then are to explore puzzles relating to complex or challenging psychological presentations in patients, with a view to developing an understanding of the patient's presentation and developing strategies for managing complexity and moving forward. To explore strategies for managing challenging patients' family dynamics. To consider team dynamics with a view to fostering healthy, empathic, constructive relationships across the team. To promote the use of effective communication to patients, families, and other team members. So many healthcare professionals may have advanced communication skills training, and supervision is a part of that. It is a part of taking that training and actively applying it day to day to the work that we do. And for people who haven't had the advanced communication skills training, a lot of the same content and awareness is used within the supervision groups. And it promotes team working and team cohesiveness and sustains team morale. That coming together and sharing and empathizing with one another is good for teams in their development. And it helps us to reflect on the impact of the clinical work so we can see how it affects us and consider good self-care practices. The sessions are an opportunity to think out loud and to learn from each other's thoughts and ideas about how we approach challenging situations. There will rarely be a simple answer to the puzzles that are raised, and the group will not seek to tell someone what they should have done, but to consider adaptive suggestions for moving forward. Our approach to facilitating the sessions is to create a space that is reflective, non-judgmental, confidential, supportive, and collaborative. Supervision is not therapy, and people should always have a choice about how much they say in a group setting such as this. I've just set out the description of what we're trying to achieve in supervision, but this simple diagram depicts the nuts and bolts of how that works. This is Driscoll's model of reflection, which breaks down to what, so what, now what. So if we look at the model, we can see simply it starts with having an experience in clinical practice. And that doesn't have to be the most complicated or the most distressing. It invites people to bring any experience that was moderately challenging or required the use of some skills and maybe left a puzzle afterwards. And the first step is simply for us to describe what was the event, what happened. in a kind of clear detail that helps us think about it as we're describing it and helps the group listen and understand. And within that, we purposefully reflect on any of the key aspects of that experience that occurred. And then there's the so what element. That's the analysis of the event. And that could sound more clever than it needs to be. It is simply just understanding it from the person reflecting on what it was like and what their puzzles were, to the group saying what they think and hear and are wondering about. And in that, discovering, potentially learning that arises from this simple process of reflection. And then we're left with the now what. So that's the proposed actions following the event. And this doesn't have to be doing something different. Sometimes it will be. Sometimes naturally arising from the process is a realization of, oh, actually, I'm quite happy with that bit, but maybe next time I'll try this or I'll do that. Sometimes the outcome is that we just change our relationship a little bit with what happened. We kind of understand it more, or we make our peace with it more, or we understand that we need some healing space and we need to talk about it a bit more. But then we action that new learning, whatever it is, and move on, continuing our clinical practice and continuing to look after ourselves. We look at the number of skills involved in the simple process that I've just described, we'll see that there are a surprising number of them. So within that process, we are developing skills of self-awareness, descriptive skills, ability to explore our feelings, ability to evaluate what was going on and to critically analyse it, highlighting our existing knowledge and any gaps that may emerge, challenging our assumptions or the assumptions of our colleagues, not in a deliberately provocative or challenging way, but simply exploring ideas can often lead to a shift in the sense we made of something. And as a result of that, we're able to explore alternatives. And again, this can make the process sound overcomplicated because actually it comes down to what feels like a simple, supportive discussion where we're exploring experiences and ideas. But in doing that, all of these skills are being fine-tuned in the process. The real beauty of the supervision process is that everybody contributes just by being there and sharing their point of view and their knowledge. No one needs to do anything amazing, but by each sharing our own piece of the puzzle, whether that be an idea, our own experience, some knowledge about a particular patient or situation, we contribute to creating a deeper understanding. When we deepen our understanding, we increase the scope of how we can respond to future situations. Additionally, changing our relationship to past situations can also be helpful in relieving distress. But don't just take my word for the value of the process. Let's also hear from some other important voices.
Hello, my name is Ruth White, Chief Executive at Rowan's Hospice. At Rowan's Hospice, we deliver care that addresses the physical, social, psychological and spiritual needs of people at the end of life, and we pride ourselves on delivering that care to an outstanding level. Clinical supervision sessions provide our teams with an opportunity to reflect on their approach to holistic care, to think analytically and compassionately about the needs of patients and their families, to share their knowledge with each other and to support one another. These are the reasons why it is so important to me and to the whole of the hospice executive team that participating in supervision is embedded into our culture. Thank you for playing your part in that.
Hi, I'm Anne-Marie Channer. I'm the clinical lead here at the Rowan's Hospice and I oversee about 4 or 5 of the services. I'm really pleased to be asked to talk about clinical supervision. I've had a history of having supervision for about 15 years, and when I first encountered supervision it was a very new experience that I wasn't entirely sure how I would approach it. One of the things I would say to you is if you find that you get to supervision and you're not really sure what you're bringing there and what you're doing there, is think about the team around you and what contribution you might make. And I think as I found my way through supervision and realised that there may be simple things or very big things to discuss, it doesn't have to be very complicated, but everyone has a contribution. And that I realised that I also had a contribution to give in supervision, to participate, but also to listen and learn about myself. So I would say, as a clinical leader in this organisation, I'm completely committed to supervision. And that isn't me just saying words. I do believe in it. I've experienced it for myself. It has transformed my practice at times. It's definitely strengthened me and made me more resilient at times when I suffered lots of my own anxiety or concerns about how I would do the job. And I think being able, for me as a clinical leader, to have staff that have that availability, a place where they can sit and it can be contained with experienced people around them, so they can come to work, do the work well, and separate from some of the emotional baggage that perhaps we collect or experience at work, and be able to go home and then come back the next day and do their job well. For me, that's what supervision should be about. We believe in you, we want to support you, and we are really committed to providing what we think and know the evidence tells us will really help you enjoy your job.
Hi, my name is Helen and I'm a clinical trainer here at Rowan's Hospice. I have used clinical supervision in a variety of ways over the last 30 years as a nurse. For me, the sessions provide a really positive and safe environment to discuss clinical events that perhaps need further unpicking and understanding. Supervision gives us protected time to share experiences, reflect, receive support from one another, and can also identify future learning opportunities. Supervision can also really strengthen a team, and it recognises that we all have something important to say that not only contributes to improving the service that we provide, but to ensure that we all feel heard, understood, and valued.
A final element of supervision that I want to share with you is your role in making supervision a success. Our ask of you is that you spend a few minutes before each session reflecting on your recent experiences and choose one to talk about. That you turn up and that you share your experiences and your ideas and support your colleagues. So that's everything we wanted to share with you about supervision. Thank you for taking the time to watch this video.